So first thing is to try and find a best image on the 2D if we can. I'm going to narrow the sector. As always, try to get the highest frame rate. If you look on the top right hand corner, we always try and optimize the frame rate there. So narrowing the sector to the area of interest, try to get rid of some of the artifact there. So let's activate the conventional color. Yeah, you can see it's coming at 55. So we should avoid that. You see the frame rate is 27. If I do this, it's 43, so your signal is going to be better. She is 30 weeks, so maybe I can increase the velocity a bit. And I'm going to increase the gain. So if I increase the gain too much, it blurs, yeah? So we need to find a balance and then bring it down. So I'm going to turn the gain down a bit, so improves the signal. If I turn it down completely, you get your just flow, yeah, which can be very helpful sometimes. So I'm going to bring back the gain. So in here, if I lower the velocity, we're going to get pulmonary veins. Maybe I will widen the sector a little bit. Maybe a bit too much. I'm going to split the image. So I'm now on 39. If I lower it a bit more, I can easily see the ductus venosus. I'm going to adjust again, turn it down a bit. See the ductus venosus easily. Yeah. In here. Baby's breathing, which is good. So as I come up, we see the pulmonary vein, the hepatic veins coming into the IVC. As I come up to the chest, you see it's impossible to interpret this signal, yeah, if you keep on that velocity. So you would have to increase your velocity to look at the intracardiac flow. It's smooth. I put it too much. If I go to too much, 134, I'm losing the signal, yeah? So I need to adjust the velocity. So I'm now on, just play around with that. I'm on 80, which should be okay. So I can increase the gain. You can see very easily here, she's 30 weeks, so there's more pulmonary blood flow. You're seeing the flow coming here from the right lung. You're seeing flow coming there from the left lung. Let's try what's called E-flow. It's a more high definition. So that's good for the septum. You can see that if there is any noise in the picture, yeah, coming here, by using the color, obviously you need to manipulate the probe a little bit. You can see clearly the ventricular septum, and you see the cavity as well. So if you have a poor signal on 2D, by putting color sometimes it fills the cavity, so you know there's a proper ventricle there. So we can try different modalities. This is power Doppler, and can be quite impressive sometimes. Yeah, by
for ASD, when do you say it's abnormal?
Sorry?
ASD. When you
this is normal.
Yeah, I know, but when you say it's abnormal and normal, in size.
It's about a third of the length of the HO7, but it's also, there is the flap valve. Yeah, to see the flap valve, you need to ungulate and come to the side. So, let's see if I can get it there. Just somewhere here in between. So there is, I can't quite see the flap valve very clearly. But this here is about roughly a third. Yeah, but even if it looks larger, you can't predict the ASD is going to close because it depends on the flap valve. And even if this is normal size, you can't predict if it's going to close because sometimes the flap valve has holes in it. So you can't really make the diagnosis of secundum ASD antenatally. Yeah? But if we come back here to, so we have a lot of shadow here from the rib, yeah? So let's put the Doppler on top of that. You can see that, you know, if you couldn't get away from the position of the baby, because I can manipulate the probe. So let's play around a little bit with the frequency. In here, the setup for the color is on, let's go into the conventional color, is on a middle frequency. And in here, I can change it to a high frequency. You can see just changing the frequency. I didn't change the gain. Yeah, I'm going to drop the frequency again. That's medium frequency. If I go there, that's high frequency. And if I go down, that is low low frequency. So there not so much difference between the low and the medium frequency, but to the high, I don't want that. If I want to look at pulmonary veins, maybe I can go to a high frequency because she's relatively easy to scan, and I can adjust the color gain. I think for her, probably the medium frequency at this gestation is better, yeah? But if you're very early in the pregnancy and you can't get the signal, you want more resolution, you use the button for the higher frequency during color. And so I'm going back to the E-flow. Again, I'm there on, deliberately increasing the velocity to 100. Yeah, but if you go into your preset, and it should come somewhere around there, but I'm on 30 weeks, I might go up a little bit. It's a combination of the velocity, which you can see on the scale there. Hopefully you can see here, this is centimeters per second. So I'm changing the velocity to, let's say, 80. I can increase the gain. Just by increasing the gain, I can see more, yeah? But it's blurry, isn't it? So it's too much gain. So I'm going to bring it down. Maybe I'll cut down the velocity if I want to see the pulmonary veins. I'm going to take down the gain on the 2D image. You can split the image and get a combination. So it depends on what you want to see. You adjust. You see now I decrease the velocity. I'm now on 61, which I'm still picking up pulmonary veins because she's 30 weeks, yeah? So the pulmonary veins are very clear. So you go down until we find, well, that's probably better, isn't it, for the pulmonary veins? And you can see how, if you do this, you can, here you can see a little bit of the atrial septum. You see flow across the atrial septum, and you can see a vein coming here from the right lung into there. But you don't always see that part of the atrial septum, so you may not be able to see where exactly the pulmonary vein is going to, whilst here I can see that that is the vein, and that is the vein, so that is going into the left atrium. So let's do a little bit of pulse wave. Just conscious about the time. So let's go back to, so if we want to do pulse wave of the different vessels, this is a completely different wrong position for the AV valves. If we want to do AV valves, we need to be like that. You're very good at manipulating the probe. So you can use any color there to help you. I'm just changing the gain. Baby's breathing, so the signal may not be very stable because of the breathing. So that's in the mitral valve. Sample volume, that's good, so we don't want it too big. We don't want it too small. We want kind of more or less something that covers the signal. Can you hear as well? That gives you a lot of information of a clean signal. And if you have the gain, let's go back. So I'm using the update button. You can see that the image has frozen, yeah? So you can have a chance of get a better clean signal. If the gain is too much, it kind of hurts your eyes, yeah? So decrease the gain, have a nice clean envelope. Then that is a good position for the aorta, so I'm just tilting the transducer a little bit. We can see the aorta here. You need to pass the valve. I can hear it. So what I'm going to do, the machines have this, I'm going to change the baseline. I'm going to increase the gain. Yeah, you can do it in retrospect, and you can choose your best signal. Again, you don't want that. You want a clean signal. Again, in that one, it's not quite the best angle for the pulmonary. So I can do the mitral, I can do the tricuspid. Let's try the tricuspid. Tricuspid is usually more unstable in terms, particularly when the baby's breathing. But again, you might have to wait until the baby's quiet to get a signal that is constant. So if we want to do the pulmonary veins for rhythm, and I'll leave the pulmonary artery at the moment because I'm going to have to change position to get a good angle, and that angle there now allows me to see the veins. You can see that here we have the red going into the left atrium, and we have a bit of blue coming towards the lungs. I'm just going to increase the gain a bit. Change my angulation, trying to get a good signal through the, that's better. is there. There's some breathing. I probably should adjust the velocity, but because the baby is moving, I just froze the image, and that's the signal I showed you. If I do this, I can see a whole screen. There is some variation because the baby is breathing. Yeah? Here we lose the signal. But this is a normal signal with your atrial systole, your ventricular systole, and that's an S wave and a D wave. And this is your atrial systole again. So you know the rhythm is normal. It's a 1-to-1 AV relationship. So even if you don't have a good M mode, and if you want to measure the AV interval, you would go from the descent of that A wave there to the peak of the pulmonary vessel is 147 milliseconds to 30 weeks, that's fine, yeah? So it's a different way of doing that. Then if I want the pulmonary artery, there's no point in measuring the pulmonary artery here, so you do need to manipulate your probe. It can come from here. Again, I'm going to make it a bit smaller because I think sometimes people are afraid of scanning with the baby in this position, that you're going through the scapula. But actually you can get very good image through here. Yeah, so sometimes even better than here. We're getting that rib in the shadow. In here the image just might come in here. You can see the atrial septum better. So narrow down. The frame rate is going up. It's 92, making it bigger. You can see now the flap valve there. Another way of looking at that flap valve is to put an M mode there. Increase the gain. You can see, yes, you can see there. This is obviously very quickly, yeah? This is the wall of the left atrium, the part of the interatrial septum, the wall of the right atrium, and this is the flap valve moving in there. So sometimes it's very static. It should move with the cardiac cycle. That's mainly because you're asking about the atrial septum. So you can zoom up there and get a good view. So from here, it's a good angle to look at the septum. And if I want to look at the septum, let's just make it a bit bigger first. It's quite good to use power Doppler, and again, you always have to manipulate the probe a bit. So you can feel the ventricles, and it's a good angulation to look at the ventricular septum. Let's choose the other one. This is high definition. And this view as well is very easy to see the bifurcation of the pulmonary artery. So the velocity is 43. There's a lot of noise. You know, she's 30 weeks. I'm going to increase the velocity. I'm going to decrease the gain. And that's a good angulation to measure your pulmonary velocity. So here we have your 3-vessel view from a not so favorable position. Baby's breathing, so that's your pulmonary valve, your main pulmonary artery, your right pulmonary artery, the arterial duct. So perfect there to look at the flow across the pulmonary. Good angulation. So that's not a good signal, but you can freeze, you can hear the sound, it's good. Bring it down, turn the gain down. It's a much better clean signal, yeah? If you have like that, you may be measuring a velocity that is, somewhere around 90, which will be fine. But if you turn the gain down, that is more somewhere around 77. So it may make a difference, yeah? And it's a clean signal. So always try and get as close to the flow direction as possible.